Here we are demonstrating minimally invasive parathyroidectomy in a 41-year-old female. She had severe bone pain, progressed over last 2 years. Her serum calcium levels were raised. Serum PTH level was more than 1200, and her DEXA scan revealed severe osteopenia across all the bones, for which she was advised system scan, and that revealed uptake in right lower parathyroid region. Her 4D CT scan revealed fairly big size parathyroid mass lesion. Skin incision was taken, platysmal flaps were raised. In right supraclavicular region, strap muscles were identified and retracted medially so as to expose the right lobe of thyroid gland. This is the placement of retractors like this. Middle thyroid vein identified and ligated. Strap muscles retracted. Right lobe of thyroid gland identified and retracted medially with very small retractors to identify parathyroid mass, separating all flimsy bands surrounding the capsule of parathyroid gland. All these flimsy bands were separated, and tiny vessels are ligated like this. Blunt and sharp artery dissection surrounding the capsule of parathyroid gland helps to separate this parathyroid mass from all surrounding structures. Tiny vessels identified and then electrocauterized to avoid soilage of blood in the operative field. Right recurrent laryngeal nerve identified and preserved. Now proceeding towards the superior pole, where the fairly big size vascular pedicle supplying parathyroid swelling was identified and clamped, which is then suture ligated. It's a fairly big size pedicle, hence ligated like this. Proceeding further to release these flimsy bands surrounding the capsule of parathyroid mass, your forceps is holding the parathyroid swelling, basically the soft tissue surrounding the capsule and not the capsule itself, so as to avoid the breaching the capsule of parathyroid gland and avoiding the cells of parathyroid being implanted in the operative field. Fairly big size parathyroid swelling was removed through this small incision, and then the post 20 minutes parathyroid hormones level were less than 100. This is recurrent nerve, strap muscles retracted, and this is the right lobe of thyroid gland. Recurrent nerve again, right anterolateral surface of trachea, and the internal jugular vessels and carotid artery. Post surgery, the scar is less than 3.5 centimeter, and the calcium vitamin D supplements were given as per NIH guidelines. HPR revealed it is adenoma, and the scar size is very small, as you see over here.